So, you're a doctor and you begin your day in a busy city hospital. Among your patients is Mr. J. He's a 45-year-old software engineer who's been experiencing persistent joint pain and stiffness for quite the past few months. Mr. J, being a tech savvy professional, he's been dealing with worsening pain in his knees, his wrists. It at first started subtly, but the discomfort has become more and more pronounced, affecting both his work and his personal life. During the initial consultation with the doctor, he described his symptoms, noting that he's having some joint swelling and some warmth in those areas. So, what organ system am I talking about exactly? Hey, my name is Charpentier, and welcome to Less Than 3%, where we talk about healthcare, my journey becoming a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I want to get into something that I am pretty excited about, and I think is going to be really interesting for anybody who's listening. So, as of the time of recording this episode, I have completed my first semester of medical school. And so it's been a few months going at that so far, and I've been able to learn quite a lot of different things. And I thought something that I'd want to do as a podcast episode would be to really share some of the things that I was able to learn, but also to be able to spin that in a way that connects a lot to really just healthcare as a whole. So one thing that I don't think I've talked about too much on the podcast so far is a lot of the different medical specialties that exist within the world of healthcare and medicine, as of course the main decision you're going to have to make in terms of getting into medical school and all of that is the decision to become a physician. But on top of that, later in your medical school journey, you're ultimately going to make that final decision on what kind of doctor you want to be. And so that comes with a vast number of medical specialties. So I thought, why not take some of the different organ systems that I was able to learn about throughout my time in medical school so far, and really be able to talk with you guys about the different medical specialties that actually connect with them. And so there's a number of different organ systems that I got the opportunity to learn about, and I'm going to continue to learn about. And I thought, why not kind of give a bit of a progress report on some of the things I was able to learn and some of the specialties I was able to think about in regards to those different organ systems. And another interesting thing that I thought I'd also add to it is really to give you guys an opportunity, whoever's listening, to participate in this. And so what I'm actually going to do is I have a couple of made up cases that talk about some of the different organ systems in the body and the different types of doctors that work with those organ systems. And so I want to give you guys the opportunity to ultimately, as I go through these cases, give a guess as to what part of the body, what organ system am I talking about, and what doctors probably work with that organ system. And so, I guess without further ado, let's get right into it. So, you're a doctor, and you begin your day in a busy city hospital. Among your patients is Mr. J. He's a 45-year-old software engineer who's been experiencing persistent joint pain and stiffness for quite the past few months. Mr. J, being a tech savvy professional, he's been dealing with worsening pain in his knees, his wrists. It at first started subtly, but the discomfort has become more and more pronounced, affecting both his work and his personal life. During the initial consultation with the doctor, he describes his symptoms, noting that he's having some joint swelling and some warmth in those areas. So, what organ system am I talking about exactly? If for whatever reason you guessed musculoskeletal, you're correct. So, what I'm talking about here is, I think it's some medical school curriculum, usually gets abbreviated as MSK. But what all that really means is just your muscles, your joints, your ligaments, your bones, just really all of those organs all together. And so, when it comes to this organ system, I'm sure there's quite a number of people that would be listening that would have an idea of what doctors work with it, but I'm going to go ahead and name them out. First, what I've written down is you have rheumatology, a specialty that some may be familiar with, some may not, orthopedic surgery, PM&R, which stands for physical medicine and rehabilitation, and sports medicine. So one thing that a lot of these specialties within medicine and these types of doctors work with that is quite uncommon is you're focusing on the muscles, joints, and ligaments found around the body and whatever diseases relate to them. So before I get into all these different specialties that have to do with this organ system, let me just start off and just name one. So first of all, what is rheumatology? What's rheumatology? So according to rheumatology.org, a rheumatologist is an internist or a pediatrician who's received further training in the diagnosis and the treatment of musculoskeletal disease and systemic autoimmune conditions that are commonly referred to as rheumatic diseases. So let me just pause right there and slow down a little bit. So when we're talking about autoimmune diseases, a lot of you guys might actually be familiar with a few of them. So autoimmune conditions occur when the immune system causes inflammation in areas of the body where it's not supposed to happen, and that'll cause damage and certain symptoms. Just name off a few diseases that rheumatologists will often deal with. There's osteoarthritis, so that's commonly referred to as your usual arthritis, where you might have some joint pain and swelling and those sorts of things. You have gout, rheumatoid arthritis, chronic back pain, tendinitis, bursitis, and also lupus. So these are a number of diseases that a lot of people in the population can often have, and rheumatologists are really able to specialize in being able to help with those conditions and try to bring not only those symptoms down, but be able to help follow up with patients a lot of the time long term who have these sorts of conditions. So now let me get into a little bit more information about rheumatology. So we talked about what exactly they do, but what are some of the other aspects of the career of a rheumatologist? Like their salary, how much do they get paid? I pulled up a little bit of information from Med School Insiders, and they mentioned in 2022, rheumatologists earned approximately $290,000 a year on average. To become a rheumatologist, you must first complete 4 years of medical school, followed by 3 years of internal medicine residency, and usually 2 years of rheumatology fellowship. And to become a rheumatologist, you must first complete 4 years of medical school, so the usual medical training path, but that's also followed by 3 years of internal medicine residency, and then you would do 2 years of rheumatology fellowship to become a rheumatologist. Now, let's move on a little bit. Let's talk about orthopedic surgery. So this is a specialty that I think a number of people are familiar with. So those are, and I have really a solid definition of what exactly orthopedic surgeon is. They mentioned that an orthopedic surgeon is qualified to diagnose orthopedic problems, perform or prescribe treatments, and assist with rehabilitation. So they can also help you develop long-term strategies to treat illnesses, disorders, and issues relating to your bones, joints, ligaments, tendons, and muscles. So orthopedic surgeons, they work again with really the same organ system that you often find with like rheumatology or sports medicine, but those are famously the doctors that are doing those surgeries in those areas. So just list off a few things that orthopedic surgeons can do according to NYU Langone Health and their Department of Orthopedic Surgery. Some of the things orthopedic surgeons will do include adult reconstructive surgery, foot and ankle surgery, hand surgery, orthopedic oncology, pediatric orthopedic surgery, sports primary care sports medicine, shoulder and elbow surgery, spine surgery, sports medicine, and trauma and fracture surgery. So there's a lot of different things that orthopedic surgeons will often do and deal with. Now, moving forward, another question to also ask is what's the salary for a usual orthopedic surgeon? So according to salary.com, the base salary for an orthopedic surgeon ranges from about $421,030 to $692,820, with an average base salary of $535,540. So that's quite a bit that orthopedic surgeons get paid for their work. So according to Med School Insiders, to become an orthopedic surgeon, you have to complete a 5-year orthopedic surgery residency, and you can also do a single research year, which is usually optional and is pursued by those who are interested in becoming surgeon scientists. So moving forward, let's talk about the third specialty I wanted to talk about in relation to this musculoskeletal system. Physical medicine and rehabilitation, also known as PM&R, also known as physiatry. It's a medical specialty that involves restoring function for a person who's been disabled as a result of disease, disorder, or injury. And that's according to Johns Hopkins Medicine. So basically what PM&R doctors are really able to focus on is not simply just helping improve patients' condition, but really focusing in on helping improve patients' quality of life, really holistically helping that patient rehab and recover. And this is an extremely broad field. So it's not like PM&R doctors, like every PM&R doctor does one particular thing, but actually there's a lot of different paths within PM&R and a lot of different things that PM&R doctors are able to do. So just to list off a few things, there's brain injury medicine, hospice and palliative care, neuromuscular medicine, pediatrics, spinal cord injury, and sports medicine. So, as with a lot of different specialties, you would have a first year that is an intern year where you'd be doing a big mix of different specialties or things that just aren't as relevant to your future career as a PM&R doctor. So, moving forward, let's take a look at sports medicine. So, according to the American Medical Society for Sports Medicine, a sports medicine physician has significant specialized training in both the treatment and the prevention of illness and injury. They're ideally suited to provide comprehensive medical care for athletes, sports teams, and even just active individuals who are looking to maintain a healthy lifestyle. A number of sports medicine physicians can often work with major sports teams as well. So that might have to do with some of the NBA and NFL players that you might see. And so sports medicine physicians really have an opportunity to do a lot of really interesting things in their practice. Looking at the salary, according to salary.com, the average sports medicine physician as of November 27, 2023 is $257,037. According to Med School Insiders, the overwhelming majority of sports medicine physicians will usually complete a family medicine residency. So there actually isn't just a sports medicine residency, but in your training, if you want to become a sports medicine doctor, you would first have to train in a different residency and then go into a sports medicine fellowship program. And so a lot of them will often first do family medicine residency, but you can also go to sports medicine through emergency medicine, pediatrics, internal medicine, or through PM&R, as we mentioned earlier. Now, that pretty much covers all I wanted to talk about for the different specialties that are often focused on like the musculoskeletal system. So there's quite a lot of options there. Now I want to go ahead and move on to the next organ system. So let's hear the next case. Today, your schedule includes Mrs. T, who's a 32-year-old graphic designer who recently developed a perplexing skin rash. Mrs. T, known for her creative work, arrives with concerns about a sudden and bothersome skin rash. She describes the rash as red, itchy patches that appeared on her arms and her face. During the initial examination, you notice the distinct appearance of the rash and you gather information about any recent changes in her skincare routine, diet, or exposure to new substances. So, what specialty could I be talking about here? If you guess dermatology, you're right. So, what I wanted to take a look at was to really just focus on one particular organ system. I think a lot might be pretty familiar with what a dermatologist is. Just to give a definition from the American Academy of Dermatology Association, a dermatologist is a medical doctor who specializes in conditions that affect the skin, hair, and nails. And just to go through a number of things that dermatologists are able to focus on in their practice, and I think a lot of people will be familiar with them. Just looking at a list from Cleveland Clinic, we're talking about acne. So I think a lot of us are pretty familiar with acne, eczema, hair loss, nail fungus, psoriasis, even skin cancer, and rosacea. So the average salary for dermatologists is about $380,200 as of November 27, 2023, according to salary.com. And to talk a little bit about the actual training to become a dermatologist, there's quite a bit of a pathway to get into dermatology as well. So according to Med School Insiders, you would have your first year, which is your intern year, and then you would focus in on specifically dermatology residency for 3 years. And there's also a number of different subspecialties that you can go into within the world of dermatology. So just to name off a few, we're talking about cosmetics, pediatrics, Mohs surgery, and oncology. So that's where we're really dealing with skin cancers and dermatopathology as well. Now I'm going to go ahead and get right into the next organ system. So you start your day in the city hospital, and today's schedule includes Mrs. R, who is a 58-year-old librarian with no significant medical history who was rushed to the emergency room with sudden and severe chest pain. Mrs. R describes the pain as a crushing sensation in her chest that radiates all the way to her left arm. Her blood pressure is high. Swiftly recognizing the signs of a potential emergency, you decide on emergency intervention. So, what organ system could I be talking about here? This might be familiar to some of you guys. So, what I'm talking about here is the cardiovascular system. So, when it comes to this organ system, we're talking all about the heart and the vessels that are connected to it. So, there's a number of different specialties I think a lot of people may be familiar with when it comes to the cardiovascular system. So, we have cardiology, which even has more specialties within that, CT surgery or cardiothoracic surgery, and vascular surgery. So, just to talk a little bit about cardiology first, what exactly is a cardiologist? What do they do? What is that about? So, taking a look at Cleveland Clinic and how they describe it, cardiology really focuses in on the function of the heart and the different vessels that it's connected to, in addition to diseases such as heart attacks, arrhythmias, and more. So, these are diseases that are very common and a lot of us are very familiar with, especially as ischemic heart disease is the number one cause of death in the world. Cardiologists earn among the highest salaries of medical professionals with an average annual salary of about $490,000 as of 2022. Now, according to Medical Insiders, we'll take a look at exactly the training path that cardiology has because there's quite a lot that goes into it. So there's actually not a cardiology residency that you would do after medical school. So you would actually go into either internal medicine if you want to work with adults, or pediatrics if you want to work with kids for 3 years. After that, you would then do a fellowship in cardiology for 3 years. Now, looking even a little bit further, if you wanted to subspecialize, as there's a number of different things you could do, like focusing in on congestive heart failure, interventional cardiology, so doing a lot of procedures, or electrophysiology, imaging, and other things such as that. You would pretty much be tacking on another 1 to 2 years on top. Let's talk a little bit about cardiothoracic surgery. So, what exactly is cardiothoracic surgery? How does that work? So, according to Cleveland Clinic, a cardiothoracic surgeon will perform surgery on your heart, lungs, or esophagus, and other parts of your chest. So, they're not just working with the heart, but they're ultimately working with whatever is within that region as well. Surgeries can range all the way from a heart valve replacement or a heart transplant to treating lung cancer or esophageal cancer. Cardiothoracic surgery is a pretty broad field where you're doing a lot of different things in that area. So the average cardiothoracic surgeon, they will usually earn about $518,900 as of November 27, 2023, according to salary.com. So according to the Thoracic Surgery Directors Association, there's 3 different training pathways in cardiothoracic surgery. So first, there's independent programs. So that's usually a traditional pathway. So you'll spend 5 years doing general surgery training, and then you'll tack on 2 to 3 years of cardiothoracic surgery residency. Another pathway is an integrated pathway. It's known as an I6. You would do 6 years of just cardiothoracic surgery residency. So that's an option in of itself. And there's also the joint thoracic general surgery track. They call this the fast track pathway, and it involves 4 years of general surgery plus 3 years of cardiothoracic surgery residency. And so it's all completed just at one institution. So there's a number of different ways that you can become a cardiothoracic surgeon. And now moving forward to the last specialty I want to talk about, there's vascular surgery. Now this is something that some of you may be familiar with, some of you may not be familiar with, but to just define it for a second, according to Cleveland Clinic, vascular surgeons are specialists who are highly trained to treat diseases of the vascular system. So that's all of the different blood vessels that are in your body. Now, in terms of some of the things that they'll work with and treat, they'll deal with stuff from aortic aneurysms to atherosclerosis to blood clots, carotid artery disease, cerebrovascular disease, chronic venous insufficiency, and deep vein thrombosis. So there are a lot of different diseases that can happen in the vascular system that vascular surgeons will work with and take care of. Now, according to salary.com, vascular surgeons on average earn about $442,437 as of November 27, 2023 in the United States. Now let's talk about how you become a vascular surgeon. So according to the American Board of Surgery, you have 3 years that are devoted to vascular surgery and 2 years that are devoted to just core surgical training. So you have a pathway of having a 5-year general surgery program and then going into a 2-year independent vascular surgery training program. Another pathway that you could take on is an early specialization program. And so you will have 4 years of general surgery training, and then you would have 2 years of vascular surgery, so a bit of a shorter path. Now, they also mention an integrated program where you would do 5 years of just vascular surgery combined with your core surgical training, which would lead to you just being certified in vascular surgery. So that'd be a quickest path. Now, I also want to throw in another specialty that some of you may be familiar with. I remember learning a little bit about this specialty, and I thought this was extremely interesting, as I didn't even know a specialty like this really existed at one point. But this is known as interventional radiology. So often you have your radiologists, which are doctors that will really just focus in on looking at imaging, x-rays, scans, all types of different things, and being able to read them and diagnose patients. But interventional radiologists, they will actually take it even a step further. So according to Johns Hopkins Medicine, interventional radiologists will diagnose and treat disease. They treat a wide range of conditions in the body by inserting very small tools such as catheters or wires from outside the body. And they will use x-rays and imaging techniques such as CTs and ultrasounds to help guide the radiologist in doing those procedures and helping those patients. So that's not only just reading x-rays and reading different scans, but also using them to actually guide you in doing different procedures. Now, the base salary for an interventional radiologist, according to salary.com, is from about $395,800 to $526,600, with an average base salary of $455,200. And taking a look at the training path to become an interventional radiologist, there's a few paths here. So according to the Society of Interventional Radiology, the independent IR or interventional radiology residency is 2 years in length, which actually comes out to a total of 7 years of postgraduate training, as you would first start with just doing general radiology residency. And they mentioned that this training format would just be available to graduates of diagnostic radiology residency. So you would start off with your diagnostic regular radiology and then go into interventional radiology from there. Now, they also mention an integrated path. So that would mean that residency curriculum is concentrated on diagnostic radiology for the first 3 years and then interventional radiology for the last 2 years. So that's a bit of a shorter path. Now, with all of that being said about the cardiovascular system, I'm sure a lot of you guys may have been able to pick out that there's quite a few paths involved, that there's quite a few specialties that work with that system. And so there's a variety of things that you can do just in terms of cardiovascular system. Now, moving forward, let's get into our next and last organ system that I want to talk about for this episode. So just as the other cases, you're a doctor, and so you're dealing with a young patient named Timmy. Now, his parents shared that he's been coughing a lot and seems to struggle to catch his breath, especially during playtime. So during your checkup, you see that the kid is having a hard time breathing, which makes you want to figure out what's going on. You do a thorough check, you listen to his breathing, and you notice he's working extra hard to be able to get air. Knowing his family has a history of breathing issues, you decide to do some tests. The tests show that he's having a hard time with his airways, and you hear wheezing when you actually auscultate and listen. So you check for things that might be causing trouble, like allergies. So what organ system am I talking about here? Now, in my opinion, I think it may be relatively obvious to some people. So what I'm talking about here is the respiratory system. So there's actually a number of specialties that deal with the system. So just to really get started, let's talk about pulmonology. So pulmonology, according to the American College of Physicians, really focuses on the upper airways and lungs, treating disease that's associated with them. What exactly is a pulmonologist? Like, what exactly do they do as a practice? So according to the American Lung Association, a pulmonologist is someone who will specialize in the respiratory system, from the trachea, or also known as a windpipe, all the way down to the lungs. If your complaint involves the lungs or any part of the respiratory system, then a pulmonologist is a doctor that's going to help you solve that problem. Something that I think is also important to mention is that when it comes to the training path of pulmonologists, they often do things alongside the specialty of critical care. So there's an option to become a pulmonology doctor, which will just focus on, again, just breathing. But there's also critical care, which I'm going to get to as a specialty as well, where the training is often done in conjunction with pulmonology training. So the average pulmonary critical care salary, according to salary.com, in the United States is 318,276 as of November 27, 2023. Looking at the training path, it's done after doing 3 years of internal medicine residency. So there isn't necessarily a pulmonology residency that you would go directly into, but instead you would go into internal medicine and then from there do 2 years of pulmonology fellowship. And this is often done, as I mentioned, alongside critical care. So looking at critical care medicine, according to the American College of Physicians, critical care medicine will encompass the diagnosis and treatment of a wide variety of clinical problems representing the extreme of human disease. This deals with critically ill patients that require intensive care by a coordinated team. And now to keep moving forward, there's also another specialty that I want to talk about. And this is known as ENT or otolaryngology. So according to Cleveland Clinic, so an ENT physician or otolaryngologist is a healthcare specialist who treats conditions affecting your ears, nose, and throat. So that entire area of the body. And so they will also perform head and neck surgeries, including surgeries on your ears, mouth, nose, neck, and your face. There's a lot of different things that ENT physicians are working with. So just to list off some different things that they'll treat and the different conditions that you would go to an ENT doctor for, that you might go to an ENT doctor for, is things like persistent sore throat, runny nose that doesn't go away, chronic cough, chronic sinus pressure or nasal congestion, nasal polyps, and also nasal and paranasal tumors. So also dealing with cancers in that head and neck region. Now looking at the base salary for an otolaryngologist, according to salary.com, they'll earn about, as an average base salary, $411,608. In order to become an ENT physician, according to medschoolinsiders.com, you'll find that after medical school, ENT is a 5-year categorical residency. So you would match directly into an ENT residency program, not like some of the other specialties I mentioned. And some programs, they can be up to 7 years where you're able to do research years, but 5 years is usually what you'll do in your training. So that really just covers all of the different organ systems that I was able to really focus in and learn about throughout my medical school journey so far. And I think a lot of you might be able to see there's quite a lot of different specialty tracks just within working with those particular organ systems. And so I really hope that a lot of people were able to get out of this episode really that very, very broad and vast field. Being able to choose from a vast number of different specialties. And so based on whatever organ systems, whatever patient population may be dealing with, there may be different there may be a specific specialty that you may want to work with that deals with a particular organ system. So that really just wraps up I think all I want to talk about. So I definitely think, as I've been able to take this time in my medical school journey so far, it's really given me the opportunity to learn so much about just how vast medicine is, and really just a lot of the different things and a lot of the great work that different types of physicians do to be able to help their patients in different areas of their health. I really just feel this was an opportunity for me to be able to reflect on a lot of those different things, a lot of those different organ systems and those different specialties that those different specialties of doctors that will work with them. And I think it definitely gave me a lot to think about in terms of a lot of the different specialties that I definitely find interesting. And I definitely think there's quite a lot to choose from. And so I think it'll definitely be interesting for me as I continue to go down this path and ultimately come closer to being able to make a real decision on what specialty I would be focusing on in my practice as a physician, God willing. So that really just wraps everything up. I definitely hope we're able to take and learn a lot from this episode. And I'll see you in the next one.